It is just a huge honor for me today to be podcast interviewing 4 people. Up on the left is Lauren Gueits. Her name sounds like Bill Gates, but it's spelled Gueits. She's a hygienist from New York. Right next to her is Ben Miraglia. Did I say Ben Miraglia?
Yes, very nicely done. Ben Miraglia.
Ben Miraglia. The G is silent. He's also in New York. Are you guys in the same part of New York?
No, I'm in Long Island.
Westchester County.
So you're drinking a Long Island iced tea, and you're just what? Just a regular Corona beer? And then
Probably
we got Rachel
Tito's.
Smith on the lower left. Wave, Rachel. She's a hygienist from Dallas. Normally, we don't let anyone who sports the Dallas Cowboys come on Arizona Cardinals territory, but we made an exception for Rachel. And then Kevin Ohlendorf, CDT,
Hello.
certified dental technician in St. Louis, Missouri.
Correct.
Which is one of the biggest cities on the map. You have the American Association of Orthodontics in St. Louis. You have
Correct.
the World Association of basically everything in orthodontics starts in St. Louis.
Yep.
And they're an interesting bunch of people because they have 95% membership. 95% of all the orthodontists are militant members of the AAO. And then
Right.
with the ADA, you know, I've been a member for 32 years. About 2/3 are members and 1/3 aren't. And then when you go to medicine, it's like nobody's a member of the American Medical Association. So I don't know what they're doing in St. Louis, keeping all their members. But what I assume they're doing is kind of like I'm Irish, so I blame everything on The Irishman, the movie Hoffa. But the thing about, you know, the Teamsters Union is you might not agree with anything Jimmy Hoffa said, but damn, all of his truck drivers, they all agreed with him.
Yeah.
I mean, those are the ones that all had burns on their fingers because they'd have to smoke because when they were falling asleep driving, when the cigarette started burning their finger, it'd wake them up. So he wasn't going to listen to it. So what the American Association of Orthodontists do, my God, their orthodontists come first, and there's no one second. They're just all in for the orthodontist. So good at you, St. Louis. But anyway, so Lauren, why don't you start and introduce all this instead of me reading 4 bios? Why don't you introduce everyone and tell us all what we're going to talk about today while you're
Sure.
drinking a Long Island iced tea in Long Island.
Actually, it is happy hour here, so I appreciate the platform and the opportunity to spend with you, so thank you. This is Team Airway Health Solutions. So Airway Health Solutions is a company we started about 2 years ago. It's a digital platform that teaches doctors how to incorporate airway implementation from age 3 all the way up to age 99. Dr. Ben Miraglia is the VP of Clinical Affairs. He is basically the backbone of this company from all of his teachings and everything that he's learned along his long career. I'm just actually going to read his bio because it's impressive and I love to share his accolades. So if I may, is that okay? Just read
Absolutely.
Sure. So Dr. Ben Miraglia graduated from SUNY at Buffalo School of Dental Medicine. He has 26 years of general practice experience in Mount Kisco, New York, including 16 years of interceptive orthodontic experience, where his focus has been on early childhood growth and development. Dr. Miraglia lectures nationally on sleep disorder breathing, clear aligner therapy, and craniofacial development. He holds faculty positions with Align Technology and is on the board of directors of the American Academy of Physiological Medicine and Dentistry. He's on the President's Council of Northern Westchester Hospital in Mount Kisco, New York, and is VP of Clinical Affairs for Airway Health Solutions. He also has been recognized multiple times, 5 years running, as a leader in continuing education by Dentistry Today magazine. So basically, Airway Health Solutions was formed when Dr. Miraglia and I worked together at Align Technology. That's where we met, and that's where I actually met Rachel Smith, who Rachel Smith is not only an RDH, but she is an amazing treatment coordinator, new patient coordinator. She does all the practice management sides, frankly, because I don't enjoy that part of it. Right? So she has all that experience. She's a huge asset to us and our clients because she is so warm and understanding and simply explains things that tend to be complicated usually for the front desk admin team, but she's also wonderful with iTero, digital integration. She's on Align faculty. She just got her bachelor's, so shout out to Rachel for that.
Nice job, Rachel.
Yes, never
Congrats.
too late. And she's really the backbone of everything financial and insurance and billing. Okay, and she's a wonderful person, as you'll see throughout this podcast. And then Kevin Ohlendorff, he's president of Ohlendorff Lab. Ohlendorff Lab. Let me say this right, Kevin. Oh my gosh. Go ahead, interrupt me so I get your name right here.
Right.
But I just know you as Kevin.
Right. Ohlendorff Appliance Lab.
Lab Appliances, right? Okay.
Appliance Lab, right.
Thank you. So Kevin is amazing. I'm going to read Kevin's bio because he's the third generation owner of the Ohlendorff Appliance Laboratory, is located in St. Louis and services doctors in all 50 states. Kevin has worked full-time at the lab for 25 years. He's attended thousands of CE courses on a variety of topics, including cephalometrics, orthodontics, growth and development, minor tooth movement, airway and sleep disorders. He's an expert in all areas of appliance therapy and orthodontics. And that is why we are so fortunate to have him on our team, because he makes all the appliances that we help our clients implement clinically. So
I feel like I just walked into the St. Louis Mafia, and so my first question in St. Louis is I opened up about it. It's the ortho capital of the world. So did this start first in Ohlendorff? Did this start first with orthodontists and it's slowly moving to general dentist, or not so much?
So my grandfather started the lab in 1933, and it was actually an offshoot of Washington University and St. Louis University's orthodontic schools. And so they needed somebody to be making appliances for them at that time. And he decided to get started with it and just has gone from there. You know, we have customers that are orthodontists, GPs, pediatric dentists all over the place. So we would service everybody.
But and then Mark is your dad?
Correct.
And is he still doing it?
No, he retired about 5 or 6 years ago.
Yeah. What age did he retire?
He was 68.
68. So he must have loved it if he's doing it till 68.
Absolutely.
Right. That is amazing. But so let me ask it a different way. If you do 100 appliances, how many are ordered from orthodontists versus general dentists?
So we are pretty much a GP lab and pediatric dental lab. So we probably have about 75% of GPs and 25% orthodontists.
Right on.
Yeah.
Right on. So my gosh. So what I don't understand most about this, Lauren, is I graduated from dental school in 1987, and I never heard word one about sleep. How did I become a doctor of dental surgery? And I mean, was I actually sleeping in class when they were talking about this? Ben, did you hear about this when you were in school?
No, and I graduated dental school just a little bit after you in 1993. And all 4 of those years, I don't think we heard the word sleep, nor did they let us get any. Because it was get in that lab and do your work. And then when you start to pick it up and roll with it, you start learning that even a medical student who goes through all those years of medical school, then an internship or residency, or they have a dozen hours on sleep. It's not in the curriculum. It's like an afterthought where they throw it at you and say there's this sleep thing going on, but the medical doctors didn't get it either.
So what if someone said to you, historical speaking, I mean, like, what kicked this off? I mean, did some famous movie star? Was it a book? I mean, how did sleep go from non-existent to it's everywhere? Everyone's talking about the importance of sleep.
Well, it probably got started with between the dental and medical communities starting to think about sleep apnea related to growth and development, and how all of a sudden you have these people who are breathing poorly at night. And part of it's probably due to CPAP noncompliance or failure, as it's not really a wonderful solution. I would imagine if a CPAP was such a perfect answer and it had 90% acceptance and use, dentists wouldn't be making appliances if the CPAP was so wonderful. But meanwhile, there's a very low interest and compliance rate of CPAP usage over time. Meanwhile, you still have patients then have trouble. And now you have a difference in direction whether or not you're treating the cause or the symptoms. So even a CPAP machine isn't a cure for sleep apnea. And then you think about mandibular advancement devices, and there's another, set of appliances that can be made, and there are different styles. But the idea there is it addresses the tongue and repositioning it while we're sleeping, not necessarily addressing a cause, which we're really attributing it to underdevelopment. If the maxilla and the mandible are underdeveloped, now you have an airway compromise. And with the airway compromise comes an unhealthy patient during the day, but also at night. And it's a little worse at night when the brain is really trying to do its rejuvenation and cleaning processes. But we only get that if we've got non-resistant nasal airflow. So the underdeveloped patient becomes the unhealthy breathing patient day and night, a little bit worse at night. Meanwhile, it produces medical symptoms. And so over time, I think that between the public and some doctors and some dentists in different directions, all kind of building a puzzle, but not necessarily together, have created a lot of awareness.
And Lauren, what was going on in your world where you saw the market not addressing something where you felt like you need to start your own company?
Sure.
What was not making you happy?
Well, I saw a problem and I saw a void, and we could fill that void very much with implementing education and awareness for just how important the dentist and the pediatric dentist and even orthodontists can be in growth and development. So when Dr. Miraglia and I worked at Align Technology, we created a lot of the GP education that focused on, a proper tooth alignment, and we took that to the next level to include airway. And that's once we got started on that, we knew that there was so much more we could offer and share with the doctors who wanted to learn more about growth and development and how they can actually help their patients breathe, sleep, and thrive.
You guys met in Align. Is this something that they're going after in a big way, or are they trying to say, I'm going to stay focused on clear aligners? That's our cash cow. Why did you guys start this company instead of Align just doing it?
So I'm sorry.
Go ahead, Lauren. Yeah.
Well, we actually created a course called Amplify. So we were the creators of that course, which kind of touched upon it. But we really wanted to go to the next level that went beyond clear aligners. There's other type of appliances like myofunctional appliances, the 2-screw or 3-screw appliance. So clear aligners are part of the portfolio, but it's not the complete portfolio. So we really didn't want the limitations to just be under the clear aligner umbrella, so to speak.
And how do you think sleep is? How do you think? When would you say sleep started to scale? I mean, it was non-existent in the 80s and the 90s. It came out of the closet. When did it start to scale, and where is it on the scaling? Like let me give you some examples. When they invented the X-ray, back in the 1800s, William Röntgen. But it wasn't until after World War II when they started dental insurance before dental insurance covered X-rays at 100%, almost no dentist in America owned an X-ray machine. And then they started the dental insurance company. It was in the Longshoremen Union, where every ship that shipped in and out of America had to go through the longshoremen. They had the country cut off, and there's the ones who started dental insurance because the president, in their infinite lack of wisdom, had set price fixes on salaries. So you couldn't give anybody a raise during the war. So the unions, with their might and muscle, said, okay, well, if we can't give us a raise, you're going to give us something. And they just picked dental insurance. That one just fell out of their head. And because of the, when they covered X-rays at 100%, like a domino, every dental office bought an X-ray machine. So when people tell me that insurance codes don't matter, I tell them to tell that to their X-ray machine, because it certainly matters. So and then when people say CAD/CAM, chairside milling, well, that's obviously everyone should do that. Well, I don't know. All my homies have 8 years of college, and only 15 out of 100 have bought it after 25 years. Whereas digital X-rays, 2/3 have bought it after 10 years. So where are we at on this? Is this going to be more like a niche market, 1 or 2%, and never get it to be as big as CAD/CAM, like at 12%? Or do you see this eventually turning into like X-rays, where 100% are going to educate themselves on sleep at some level? Where are we at in the rollout of sleep medicine and dentistry?
Well, that's certainly growing over time, but like you said, 10 years ago, non-existent. Maybe in the last 5, there's, total awareness, but not adoption of it all in every practice. Certainly, maybe it's just being introduced in the dental schools, but the idea is, dentistry's had 100 years run of focusing on the teeth, and if you're starting to look a little bit further, you start recognizing that the real problem is the foundation. The teeth are almost incidental at that point. And so the idea becomes, will dentistry refocus its effort on the foundation versus the teeth? And focusing on the teeth may improve, the teeth, but it may not necessarily change you from an unhealthy human being to a healthy human being. Whereas when the focus is on the foundation, you can take an unhealthy human being and make them a healthy human being.
Well, when I was in school, they said there were three things in dentistry. There was caries, peries, and occlusion, and there was something that rhymed. Caries, perio, occluso. I used to have something that rhymed.
Yeah, a little jingle.
Yeah, I had a jingle on that. Cario, perio,
Yeah.
occluso. But would you call?
I'm happy we forgot it.
Would you say that sleep is part of one of those three, the occlusion, or not, and totally separate?
Well, we're talking about a whole human being, and so it's anything that's happening to that human being will have almost a direct connection to how well they're breathing. And so a human being is an obligate nasal breather. And if you're nasal breathing without resistance 24 hours a day, 7 days a week, 365 days a year, you're going to be a healthy human being. But the moment you have nasal airflow resistance, even if it's a small amount, you're going to be an unhealthy human being, and welcome to the world of medical symptoms as you're aging. So the idea is the foundational growth of the maxilla and the mandible deliver your airway resistance. And it begins with the nasal chamber. But as you have that underdevelopment delivering your airway resistance, you start to develop symptoms. So when you think about the patients with mild malocclusions, they tend to have mild medical histories. And then the patients with severe malocclusions tend to have severe medical histories. But in any of those categories, they get worse over time. And human beings are generally built to be healthy, unless, of course, there's a pathway towards unhealthy. It just so happens that the maxillary size is really the key to how that patient's going to age in a healthy or unhealthy category, as the maxillary size delivers the breathing through the nose.
Well said. And Rachel, you're a hygienist from Dallas. Did you get into this just because you were so sick of watching the Cowboys lose that you just wanted to get into something else?
Well, let me just clarify that even I live here. I'm actually from St. Louis, so I'm part of the pack from St. Louis. But our family, my husband, we've always been Miami Dolphins fans. So I'm not a Cowboy fan. So you and I can be friends again. But I will kind of answer your question.
My Cardinals came from St. Louis.
That's right.
I'm aware. We watched the truck drive away, didn't we, Kevin?
Yes, we did.
So Kevin's your husband?
No, he's not my husband, but he and I are like we're St. Louis buddies. Like we're both from there. So anyway, go ahead. I was going to say I started in a practice that we addressed, and you were asking about how sleep became popular. Doctors or dentists were looking for an easy way to use insurance to have some income. It's easy to make a sleep appliance. You can get a non-CPAP. So I think that's its entry into dentistry. But what we've discovered over time, and this is why I love being part of Airway Health Solutions, is just like Dr. Miraglia said so nicely, we treat symptoms all day long. When somebody has a cavity, we fill it, but we don't ever ask, why did this patient get a cavity? If somebody has gum disease, do we really spend the time to figure out what the causative factor is? And the difference with Airway Health Solutions is we're trying to solve the problem, not just treat the symptom. So you can make sleep appliances all day long, but we're not really trying to make a difference on these patients. And if you think about even your practice, Dr. Ferran, looking at all your adult patients, if you have someone who has a severe malocclusion, they have a very complicated medical history. And I've seen patients for the last 5 weeks here in Dallas, and I can't tell you, once you start seeing these issues in these littles, you know where they're headed because you can see their parents and their grandparents. And that's really our mission, is to get these doctors on board with some simple things to implement into their practices to change these patients' lives at an early age all the way up to when they're older. And so that's really what I think has really made a difference.
That is amazing. And so Kevin, is your lab, is this, well, if you made 100 appliances in your lab, what % of them have to do with sleep?
Well, the specific sleep appliance is probably about 5%. But if you're talking about arch expansion and arch development appliances, that's probably about 50% of the appliances that we fabricate. And it's really about, I can't tell you how many sleep doctors I've talked to who have said, gosh, if I could have gotten to this patient when they were young and developed their arches out naturally where they should be, how much a difference that would have made to them as they grow older, and maybe could have totally eliminated the need to even be on a CPAP or a sleep appliance at some point. So that's one of the big things that this team is working with, is trying to start early to get these arches developed where they should be, to get the patients the growth and development where they should be.
And what do you, on your website, what should my homies go to? I mean, you have airwayhealthsolutions.com. Ben is bgmdental.com. Ohlendorff appliancelab.com. Gueits.com. Which website, if they could just remember one?
I would say the airwayhealthsolutions.com, because that encompasses everything that we're doing together as a team to help the doctor implement airway health at any age. So the beauty of this is we have two parts to our company. Is we offer education. So we were live pre-COVID, and now we're online for our 2-day mini-residency, which we have the 1 day teaches pediatrics. So we're really thrilled that our doctors, after taking the courses, there's common threads throughout that saying it's eye-opening, it's implementable, there's an instant return on investment. So we really hold a lot of pride and care to make sure that the doctors can implement what they learned come Monday morning. We also have coaching as well. So some doctors need a little bit more hand-holding after they learn the myofunctional appliances, after they learn expansion appliances, after they learn how they can utilize clear aligners more like an expansion appliance. Then we also have coaching all the way around, from team coaching, financial coaching. Kevin actually does a lot of coaching with our clients. And then, of course, Dr. Ben Miraglia has his services where he'll do the case reviews and case setups.
And you also have another dentist, Felix, right? Is he?
Dr. Liao just joined as a guest faculty, and we thought it was such a great fit because he's holistic. So he's airway and holistic. So he brings a whole other entity to us with nutrition and wellness. So we're really thrilled to have him on board for whole health integration.
And I want to say, because that's a trigger word for my homie. So a couple of people, when you said holistic, they actually went off the road.
Oh,
and
no.
Now they're trying to. So I just want to tell dentists that I want to call you on your own shit, because there's a lot of threads on dentistry that holistic is crazy. But every time a dentist gets sick on Dental Town, oh my God, they're holistic. Like when the patients have high blood pressure, they're supposed to take this prescription. When the dentist gets high blood pressure, like, well, what's going on? They're like, well, dude, read the K factor by an MD, PhD. You need to eat 4 grams of potassium for every gram of sodium. How come whenever the dentist gets sick, they're all holistic, they don't want to do pharmacology, they all want to get to the root of it naturally, and then when a patient doesn't know what holistic means, what they're just saying is, I see the American healthcare system. Everybody's on a dozen pills and prescriptions. I want to do it more naturally. They just raise their hand and say, well, do I have to take all these pills? Can I do it naturally? And the dentists are like, you're an idiot. You're holistic. Get out of here. But I do know for marketing that when dentists put on their website holistic dentist, that they have patients that drive an hour across Phoenix and pass 50 dental offices. And they're not holistic. They're just saying, like I'm saying, like anybody with a brain cell knows that Americans are 5% of the globe's population and they eat half the prescription pills. Okay, you don't have to be a math major to figure out that something's probably not right when 5% of the people eat half the flippin' pills. And so holistic to me means a person is having trust issues with the healthcare system. Well, hell, if you don't have trust issues with with everything about America, then you're naive. I mean, you should, it's a living project. And it's always cleaning house, and I like Felix. I mean, he's a DDS. He's got his MAGD. He's got his ABGD. I mean, he's the author of A 6-Foot Tiger in a 3-Foot Cage.
Yeah.
Great. So okay, so let's. I'm gonna go with the This is who I'm aiming my podcast at, right? I'm not worried about a bunch of. I'm gonna be 58 next month. Okay, so for all practical purposes, I'm done. I raised my kids. My 4 boys turned into 6 grandkids. Everything's fine. I'm not worried about 60-year-old dentists. I'm worried about 25-year-old kids that just walked out of dental school with $400,000 in student loans. And I want to ask Ben, how much did they learn about sleep in their $400,000 of student loan debt education, and they just graduated a month ago?
Very little. And probably not enough to implement. And so certainly they have opportunities to take continuing education. And that's where there's that, fork in the road. Are you choosing something that is geared towards treating a symptom, or are you choosing something that's geared toward treating your cause? And so our entire program is built so that we can train doctors how to treat the cause, which means how do you grow into the full size of the maxilla and mandible that you were supposed to be delivered. And so the idea is we're dealing with a population of people that is wildly underdeveloped. And in the maxilla and mandible, that underdevelopment is going to deliver that airway compromise. And so the course isn't really a sleep course. In fact, I don't treat sleep. I treat underdevelopment. And so what we're diagnosing is underdevelopment. Because when your maxilla and your mandible are underdeveloped, that's your diagnosis. Obstructive sleep apnea, sleep disorder breathing, those are symptoms. Those are symptoms you get when you don't breathe well, and most people don't breathe well because they're underdeveloped. That underdevelopment can be corrected. It can be corrected at any age. Most importantly, in the younger population, if you correct it, you never see then the adult symptom list that comes from your sleep disorder breathing or OSA. And now you have enough research to show that almost every medical condition has a link to obstructive sleep apnea or sleep disorder breathing because it delivers a lot of inflammation and sympathetic drive. And so that combination of the inflammatory response and the sympathetic drive is a real troublemaker when it's a chronic condition. And that goes back to the healthcare system that we were just mentioning a moment ago, because the sad reality is that there's no longer health or care in the healthcare system. And so what's happened in the medical community is that the medical community, the Western medical model, has chosen a path. And the Western medical model is a symptom-based model with the pharmaceutical solution. And that's the main path. When you're thinking about your bell curve, the Western medical model treats the majority of patients through symptom-related pharmaceutical solution. And now that doesn't offer people an opportunity to heal. We're managing disease. That's not healing someone. Now, if you think about where does all of your medical symptom list come from, well, the majority of those medical symptoms arise out of long-term chronic issues. So if we think about our medical community as far as acute and chronic, well, acute is I'm climbing up the ladder to change a light bulb, I fall off and break my leg. I didn't have a broken leg a minute ago, now I do. So I have an acute medical issue. I'm going to go to the best orthopedic surgeon. I'm going to get some surgery, put my leg back together. I can go run a marathon after my training again. So in the acute category, our medical system is really spectacular. A car accident, you want to see an American orthopedic surgeon to repair you and put you back together. But where our medical system's gone off the tracks is in the chronic issues. So acute, they've got it covered nicely, but chronic, it's a total opposite world. And that's where that symptom-related pharmaceutical delivery to manage disease over the long period of time has become kind of the failure of the Western medical model. So we don't handle chronic issues very well. And like you were mentioning, high blood pressure and the long list of inflammatory and chronic issues that arise, most of them have acquired backgrounds, not genetic backgrounds. And when you think about the breathing and what that does to someone while they're trying to, so-called sleep and then get repaired and cleaned and rejuvenated overnight, the sympathetic drive and that inflammatory reaction that is low level, but now chronic as the years are going by, they're turning into decades. Next thing you know, you've got a patient that's really suffering and struggling. And certainly the best way to address your breathing issue is to first make sure that you have all of the growth and development you were supposed to have so that the air could actually flow from the nostril to the lung without resistance. So having a fully developed maxilla and mandible is really the key. It's different than just positioning the lower jaw forward. And that is an opportunity. And for some patients, that's a good choice. But that's not part of our program where we're teaching to advance the mandible with a sleep appliance. We're teaching techniques that grow and develop the maxilla and the mandible so that not only does the nasal chamber have room for the air to flow, but then the tongue has a bigger chamber. And that's what you were referring to with Dr. Liao's book, that 6-foot tiger, 3-foot cage. Well, it turns out the tongue is a majority of this breathing issue, and it's trapped in a smaller world. That underdeveloped jaw structure delivers a tiny cage for that tongue to live in. And meanwhile, if we could advance that wall out farther, next thing you know, you got a bigger cage. You'd love to have a 7-foot cage for the 6-foot tiger. So if we could have that opportunity to give you the growth and development back from the age of 3 on up, now you're making a difference because you're delivering a patient that doesn't have a chronic inflammatory response and doesn't have chronic sympathetic drive while they're sleeping or even while they're awake. Now you don't have to be the average American at age 50 who's taking 5 pills.
When you were talking acute, were you talking about Rachel or Lauren?
Yeah, my 3 children.
Oh, you're too kind.
And those 2.
Lauren, but Rachel, I want to ask you. You're a hygienist, Rachel Smith, RDH. There's another Rachel hygienist, Rachel Wall, and Inspired Hygiene. What % of the hygienists do you think are showing interest in this? Is this taking off in dentistry and hygiene about the same rate, or the dentist getting more interested in the hygienist lagging, or vice versa? Where are the Rachels, the Rachel Smiths and the Rachel Walls?
I know just from being in the areas that I'm in, as far as social media and that type of thing, there are a lot of very discouraged hygienists out there who are looking for ways to actually treat their patients. And of course, if they're working in a typical dental office, it's driven by what the doctor knows. So what does the doctor know? What's the doctor's passion going forward? And there is a lot of opportunity for hygienists to be those initial assessors. That's what we're so good at. We see a patient and we have to collect a lot of information to present to the doctor. And in that, in our oral cancer screening, Lauren has done an excellent job, and with all of our teams, to help our hygienists who take our courses to look for these things very simply while they're doing their oral cancer screening. And one thing that is widely not looked at, and I've met many hygienists and asked them, no one looks at the tongue. And the tongue is so key to success with orthodontic movement, with growth and development. So we really need to make sure that we're looking for those things. And once we all start looking, because once you see it, you can't stop seeing it. But I think if hygienists could be inspired that way to look and try and solve some problems for these patients and find it early, we have a great opportunity in dentistry to make a difference for our patients' overall health.
Okay, now I'm going to say something, and I don't want you to hate me and get off and walk out of the deal. But I'm just telling, when I say something crazy like this, these are what my friends are telling me. Now remember, if they're a friend with me, they're probably told me drunk at a bar and don't even remember saying it. But but Rachel, I hear this all the time. Dude, this is a fad. You know how many fads I've lived through. God, I mean, and then they can just start naming off fads. So what do you tell a dentist, Rachel, when he says to you, dude, you're caught up in another fad? 5 years from now, no one's going to even be talking about this.
So we have this huge COVID world that we're living in, right? So all of us are dealing with this on one way or another. I think this is an excellent opportunity for us as dental providers to create some real change for healthier immune systems without creating a bunch of aerosol. My whole dream is for us to take these patients, assess their needs, put them in the proper growth appliances that they need, and solve some problems. Now, doctors can continue doing what we learned in dental school. You just brought this up, $400,000 worth of dental debt. And what have they learned how to do? Prep a tooth. A lot of them don't even get to take a clinical exam. They're going to take their clinical exam on a typodont. That's realistic, right, docs? Not necessarily.
Hey, that typodont has a name. Her name's Ann, so let's be respectful.
Correct. Yeah, so I think that these doctors that say, you know what, you can continue doing what you're doing and being a slave to PPOs and drill a bunch of teeth and let Delta Dental decide what kind of money you're going to make, or you could get up every day and work a little bit smarter to solve some problems for your patients. So it's up to them to make that decision or not. But I certainly, because I do mostly fill-in hygiene now in Dallas, which is interesting. So in the last 5 weeks, I've been in multiple practice settings and multiple dentists that I have talked to. So there's an opportunity, and the ones who really want to make a difference, get them before they learn any bad habits. When they're right out of school, the world is your oyster. Find a path that makes sense to you that's going to be different than everybody else that's on your street. And we have a way to show our practices how to do this in a simple way without investing $300,000 in a CAD/CAM machine and all kinds of crazy stuff. We give them a path so that they can really make a difference, and then of course be profitable as well.
And I think hopefully, when something bad happens, like I don't care what happens bad to me if I learn something. I mean, some lessons, you got to go to dental school for, you got to go to 8 years of college and come out $400,000 to learn something. And sometimes you can learn something just by getting punched in the face by your older brother. You know what I mean? And you're like, okay, I shouldn't do that again. Do you think, I'm hoping that this, we were on the brink of another, Lehman's brother was 2008. It had been 10 years. The Buffett index, the value of the stocks in America was about 125% of the economy. And whenever that happens, there's usually a correction. Everybody was thinking there was going to be another Lehman's Day. And then the virus came, and now you have racial tensions out. And then you got a presidential election in 5 months, which is kind of bizarre because 5 months ago, no one knew anything about this pandemic. So if you want to know how far that election is, we're basically at the halftime of the shit show, and we've had 5 months the first half, and it was horrible. So God only knows what's going to happen in the second half. But I hope that all this is going to be some structural changes, because when you look at healthcare, well, our healthcare system wasn't very good when it was tested in a pandemic. And you said Delta Dental, the Delta Dental fee really isn't set up for, it's set up for high volume, low margin. And I used to, when I got out of school, my God, I would run into a hygiene check with Rachel, and then I'd go numb this guy up. Then I'd go do a crown prep and let the assistant pack the cord wide. I was running around 8 rooms. Well, now I got to get dressed up like I'm going to do my first moonwalk, and it's no longer a game of volume. So their first question to you is, okay, pre-pandemic, I was PPO, which, by the way, 95% of all dental offices participate with Delta, and they set your fee. If you're a young kid, just a reminder, when I got out of school, I wrote down my own fees, and all the insurance company just told me what percent they'd pay. They pay 100% of cleaning exams, x-rays, 80% endos and fillings, and 50% for crowns, dentures, partials. That was the gig. And then 10 years into it, they said, no, we're gonna tell you what your fee is and pay you a percent. But the whole thing was designed for upping your volume, lowering your margin, so you were just running from house to house, putting them all on fire. Now we have a pandemic. I can't do volume anymore. It's no longer a game of volume. So my question to you is, Rachel, how does this fit in a post-pandemic world?
Dr. Miraglia and I were having this conversation because both of us are treating patients again, how difficult it is for communication. So we're going to have to rely on technology, possibly doing some Zoom pre-screening for patients who are interested, so that when they are in the practice, we're being efficient with our time. So I think there's a way for us to do that. And the other thing is that when you are providing this type of service for your patients, you can do a lot of this without all that PPE on. So you can do a lot of your pre-screening and those type of things. And you get to actually go down a path where you can take your time use that relationship-based model that we know is very effective. But when you're running around putting fires out, you're basically, tripping over dollars to get to pennies because you're just volume. And you know what? The pandemic has given us an opportunity in the dental community to slow down, do things the way that we should be doing them, and make a difference for our patients.
And a lot of it's just listening to your patients. Like I had a friend of mine where, the young people, I'm in I can only speak of Arizona. But if you're not familiar with Arizona, we're the Florida of the West. So that's every batshit thing that's ever happened in Florida, add about 15% to it. That's Arizona. But so in Arizona, if you're 30 and under, you're not going to get pregnant. You're not going to get STD. You're not going to get corona. They're fearless. You look at the bar scenes at night, there's 1 million people and they still just want to dance with Shawanda. So the people that need all the dentistry are, that the implants, crown and bridge, all that, they're all 60, 70, 80, and they're afraid. So in just listening to the cancellations of that, now my friends and the dental officer are calling back and say, well, by the way, if you pay for your whole treatment plan in advance, we'll schedule an appointment, and it's just going to be you, me, and the assistant. And, man, they're getting a $2,500, $5,000 case in 3 or 4 days a week. And that lady is so lucky because grandma's in there. I mean, come on. I'll be 58 next month. I got 4 boys under 30. I guarantee you I would have twice as much trouble with COVID-19 than 30 and under, right? I mean, it's one of those obvious things in life where it's always better to be younger than older. So, do you think how will this fit into this post-pandemic world? I mean, how are you envisioning this?
Well, first, I don't know, Texas is its own kind of crazy, so I'll own that for a second. But in the past 5 weeks, I have been actually pleasantly surprised at the amount of patients who are grateful to come in and have a wellness visit. We've done a great job in dentistry letting our patients know how important it is to come in for routine care. And I've had patients in their 80s and their 70s, and we just assure them we are following the protocol, and they're more than willing to come into the practice. But the patient where we really can make a difference are for those moms and dads who are so frustrated because, their kids on 5 medications, they're 12 years old and on a CPAP, and where are we going to solve this problem? And that is really what makes a difference, is by helping these parents understand there's a solution to their child's problem. And then also my own husband was a 4-by extraction retraction orthodontic case, and he suffers with a CPAP. And we're on a track right now to grow his arches at 52 years old. Oh, I'm 52. He's 54. So we're going to grow his arches and get his airway back because somebody robbed it from him years ago.
Rachel, where were you born and raised?
St. Louis, Missouri.
Dude, you always check the teeth before you buy the horse. How everyone knows that. You didn't look at his bite.
He was so cute. He only snored a little bit at 25, so I thought, oh, how sweet.
But that's a true story. When you're in Kansas, I grew up in Kansas. You always check the teeth before you buy the horse. And those older people say, man, they got bad teeth at 2. You're gonna lose out your money on that horse. This is very strange. So I want to go back again. I'm trying to refocus my podcast post-pandemic. The switch to my podcast wasn't about the pandemic. It was about the kids. You know what I mean? Again, guys. So I'll give you a hint of why I don't care about old people, old dentists, and that is, the Dental Town classified ads have been out since 1999, and you usually have about 5 advertisements looking for an associate for every 1 selling a practice. Now it's 2 guys selling a practice for every 1 ad out for a kid. So, and I look at those people. I know these people. They're all, if you're 60 and over and you're debt free, your kids are raised, and you're just like, you know what, I'm just done. I'm done. But the kids, so I'm trying to focus this back to the kids. So they just walked out $400,000 student loans. They've been working on a mannequin. It's very sad. They know nothing about sleep, and they go to your website airwayhealthsolutions.com. I see a webinar on there by Leo and this Miraglia dude. What is his name?
Miralgebra.
More algebra.
Yeah.
So she's 24. She's $400,000 in debt. She's very interested. She's in the middle of a pandemic. What is she going to find on airwayhealthsolutions.com?
So what I really encourage every listener to do is listen to that webinar because it's eye-opening. There are so many aha moments which reconnect the head back to the rest of the body and really empowers the dentist to become what Dr. Liao calls a mouth doctor. Where you're really taking care of the whole body so they can see for themselves cases. Everyone likes to see results. So in this webinar, there's case reviews, there's patient testimonials. They can see for themselves the benefit that growth and expansion will have on any age. If you are underdeveloped at any age, the dentist can help get the person back where they should have been in the first place, genetically speaking. So maybe Dr. Miraglia can touch upon that with the epigenetics and some of the myths beyond expansion.
And one thing I think, my buddy Fred Joyle, who's been on the show a couple of times, founder of 1-800-Dentist, he says everything is marketing. The Pankey Institute, what they do is, they have 6 one-week classes. Well, it's hard for a 25-year-old to go from, I'm seeing an ad, now I'm going to cancel a week, fly. The only reason I did it the first time is because it was in Key Biscayne, Florida, and my 4 boys wanted to sit on the beach and play in the sand while Daddy went to school every day. So after I went to the first week, I didn't even know if I was going to go back, and my 4 boys said, no, we're going back. You said it was 6 full weeks. We're ready for 6 weeks in Key Biscayne on the beach. But anyway, what they did is they made a 1-hour online CE course on Dentaltown to kind of explain the week. And they said it was the best marketing thing they ever did. And Dentaltown has put up, we have over 400 1-hour courses. They've been viewed 1 million times. You should take that webinar and make it an online Dentaltown CE.
Absolutely.
Yeah.
It's done. I'll send you the MP4 video.
No, I got the MP4 right on me on the Dropbox. But I'll send that to I'll email you, Lauren. I'm Howard at dentaltown.com. Okay. But the guy in charge of that is another Howard. So he goes by Hogo, Howard Goldstein. But I will send you the email right now because I watched that webinar in preparation for our lecture. And my gosh, the first thing I thought is, shit, Ben could probably do 40 courses, but to give them enough to get their interest, and they hear that, then if they want to learn more, then go to your website and keep the journey. But with the kids, to sit down and tell them of how to drive from Phoenix to Dallas to go see Lauren, they're not listening to the instructions till they first find out, well, why the hell am I going to Dallas?
Right.
And then once they realize, oh, wow, yeah, I really want to go to Dallas, then they start taking in the information. So you got to do something I would do something on Dentaltown Online CE to spark their curiosity to go. But tell us, Ben, the overview of that Felix and Ben. Is it Ben and Jerry's or Ben and Felix?
That is the ice cream of choice. Yes. We'll be having that shortly. The overview is that in the hour you kind of get the why, and why would you want to be involved? And the short story is that thanks to westernization and industrialization, we then shift from a natural hard diet to a natural soft diet. And that early soft diet requires less muscle use. And if you have an early soft diet, well, now you don't have musculature that will be as strong, which then doesn't promote the bone growth. So you get your jaw growth primarily from muscle use. Now, an early hard diet delivers great muscle function and strength, which delivers incredible jaw growth, which is why in pre-industrial or pre-Western cultures, we don't really find malocclusion very much. We find fully grown jaws, 32 teeth, uniform, lack of variety, class 1 type of good occlusion. And when you have fully grown jaws, not only do you have 32 beautiful teeth to display, you have plenty of room to breathe through. Then introduce an early soft diet into Western culture, which is now the predominant way to feed a baby from 0 to 2. That early soft diet with the weak musculature which then becomes secondarily dysfunctional. So you have weak and dysfunctional muscles do not promote bone growth. Without the bone growth, what we end up seeing is just crowded teeth. So crowding of teeth is very common. Meanwhile, it's a symptom. And what you have is that underdeveloped jaw structure. So getting back to the student who's got the $400,000 debt and needs to do something in a dental practice, well, at this point, since every child is 6th or 7th generation post-industrial or Western living, the child, the parents, and the grandparents are 4th, 5th, 6th, or 7th generation. You have about a 99% rate of underdevelopment. It's very difficult to meet a human being who grows on their own all the way to 32 teeth where they belong. And yet that was the case pre-industrial living. That was the case as the normal or ideal pattern for growth and development was that cultures throughout the world grew their jaws fully to position where 32 teeth were represented, and you had lack of variation. All of a sudden, introduce that Western lifestyle and that soft diet early. Next thing you know, we've got underdevelopment. So that gives that student the opportunity to treat pretty much every patient they meet at any age through growth and development techniques, not just holding the tongue forward at night. Slightly different opportunity. It's difficult to find a patient who is not underdeveloped. And so this is my 17th year of doing growth and development, mostly across any age. I don't really meet many people in the course of a year that don't need attention. And it's very rare to find a child go to a teen, go to an adult, and have 32 teeth erupt where they belong. That would be like finding a unicorn. So now that produces your patient pool. It's everyone except for the patient that has all 32 teeth going right where they belong. That's a fully grown human being. That human being doesn't need any attention. Every other one does, because that underdeveloped human is going to come with a medical symptom list that you could have an impact on.
By the way, my granddaughter, she's 4, and when you ask her what she wants to be, she just now switched from unicorn to dentist like grandpa. So it took 4 years just to get her to be something. And anyway, so you're but I have to tell you something. I'm gonna be real honest here. I'm still blown away that I missed all this for so many decades. When after me and Dr. Glass took our first sleep course, whenever that was, 5 or 10 years ago, hard to say. I mean, like just the other day, somebody came over and they had a 4-year-old, and the 4-year-old was playing with my grandkid. But when he took a nap on the couch, he was just laying there. It sounded like marbles were munching his mouth. Yeah. It's like, okay, now, how did you get to be 58 before the first time you ever realized that some 4-year-old kid on the couch is grinding their teeth? So this was in front of me, but my mind just didn't see it. But my gosh, when I told the mom, I said, do you hear that? And she goes, that's why I can't have him sleep in my bed, because his marbling deal. So when you hear a story like that, what's going through your mind, Ben, when you're hearing about a 4-year-old kid?
That child's suffering. That's a chronic level of choking, to be deprived of proper breathing. And so that child with resistant airflow, you can hear it and see it in the breathing. Now, a human being that's an obligate nasal breather, when you're breathing really well through your nose, it's silent and invisible. No one should be able to see or hear you breathing during the day or at night. And the children that you're looking at, if they're sleeping, it's one thing to be hearing them. But as you roam around and you get around quite a bit, what you should be looking at is how are they breathing? And it's very rare to find a child that keeps their mouth closed and breathes through their nose continuously. Most children are so underdeveloped by the time they're 4 that they are now becoming mouth breathing as a predominant form of breathing, and the mouth was not prepared to set up the air for the lung. The nose was for the breathing, to prepare the air for the lung. So as soon as you're mouth breathing, what you're delivering is a sympathetic drive inflammatory response in a chronic pattern, and that child will then develop all of the symptoms that are listed for sleep disordered breathing. And gradually, because that child over time is going to continue that pathway or spiral, and one day they'll get an OSA diagnosis. But the idea is not to let a child graduate to the OSA diagnosis. By then it's too late and you've missed your opportunity to create the healthy human being. The idea is to correct your underlying problem, the growth and development, so that you can have your breathing back, which should be silent and invisible nasal breathing, so that child doesn't spiral to the eventual diagnosis of OSA. Every patient who gets an OSA diagnosis had a first step. The first step to getting to OSA is nasal airflow resistance. The second step is mouth breathing. Nasal airflow resistance delivers mouth breathing. But interestingly enough, you get your nasal airflow resistance from underdevelopment. So the pathway to OSA is underdevelopment. And really the pathway to correct it is growth and development. So the child at 4 who I hear that, it's heartbreaking, but in all my travels, and I've had the last decade of traveling to a different city every week to teach, I'm in and out of airports and restaurants on a weekly basis throughout the country. I used to be looking for the mouth breathing because I could see it right away. Mouth breathing, mouth breathing, mouth breathing, mouth breathing. I got tired of looking for mouth breathing. I said, I got to find a child who breathes through their nose and keeps their lips together. And it's almost impossible to find a child who's got their lips together for any extended period of time who's breathing through their nose today. And that's all a function of the almost ubiquitous early soft diet. And so that lack of muscle use delivers a lack of bone growth, which gives you your so-called crowded malocclusions. But meanwhile, what the child really has is an airway compromise. So what we're doing is we're switching the focus from the teeth to the foundation. Dentistry shouldn't be staring at the teeth because that doesn't necessarily make a healthy human being. It's still important to address the teeth, but it should be foundation focused, teeth second. Then you solve medical symptoms and you deliver a fully healthy human being.
And this is you keep finding these different things through life, and then later you connect them, right? And
Yep.
When the Arizona Cardinals, where the St. Louis Cardinals moved to Arizona and became the Arizona Cardinals, just by random luck, they were about 3 miles down the street from me. I was in Phoenix, and they were on Warner down in the Tempe. And so for a marketing thing, what I did is I called and I got their roster and I got the names of their employees because the place is fenced off. It was like a military compound. Nobody was getting in there. And so I made a cup with all the fancy gums and toys and sugar-frees and all that for all the players, all the coaching deals. And then I sent the 2 youngest, cutest girls we had because, you know the guard's not going to tell 2 young cuties to go away, and they went down there, they delivered it. So we got a bunch of in fact, Bill Bidwell, who passed away lately, he was I don't know if I can HIPAA say that, but he came to the office and all that, and a lot of the coaches, a lot of the players. But going clear back to then, one of the first things of meeting a professional athlete, one of the first things I remember was, and I said, well, what's it like going from college to pro? And they go, well, some of it is just so hard. And I said to this guy, like what? Give me one thing. He goes, well, they're taking electrical tape and they're putting it over my mouth because if I work out breathing through my nose, it covers it with nitric oxide and makes me perform. And just to break the habit between, breathing through my mouth and breathing through my nose, that alone is just blowing my mind. And then here it is 30 years later. And I'm like, okay, I learned that first from a football player, and why did it? And now 20 years later, I'm hearing it from Ben. I mean, have you heard that, Ben? Have you heard of professional athletes doing that?
Oh yeah, your highest level athletes, whether it's professional or Olympic level, those athletes have breathing retraining, and they spend a lot of time and investment on getting to do the nose breathing. And take a look at your marathon runners. If you watch those marathon winners who run the 26-mile marathon in 2 hours, they breathe through their nose predominantly through that. So the better breathing comes through the nose. It fuels the muscles better, the brain better. Everything happens through nasal breathing. So if you're going to be the highest level athlete, there's a fair chance you've had breathing retraining as part of your conditioning to make sure that your mouth stays shut and your nose does all the breathing. It's really healthier on every level, but it'll give you better performance.
I just did my first marathon last week, and I almost made it all the way to the finish line, but I couldn't, and I had to change the channel, and I started watching something else.
Yeah.
Did you take him out?
I was going to say you got a flat tire, right?
Oh my God. Yeah. So she's 25. She's listening to this. If she goes to your website, she's got a 1-hour webinar. By the way, I wish, you could just post that yourself on Dental Town. What I love about Dental Town is, all the social media is just last in, first out. It's just set up for entertainment. It's fun. it's got a place where when you're bored, you're just scrolling through Twitter or Instagram or whatever. I keep getting asked all the time when I'm going to post again on Facebook. I had 300,000 followers on Facebook at Howard Ferran, and after the pandemic, I just said I'm not doing it anymore. And the reason why is because social media on Dentaltown, it's index form. Like if Lauren posted this really neat thing, and 6 months later, I'm like, I want to get that thing she posted. What am I supposed to do? Go to your page and scroll back for half an hour? Where I can go to Dentaltown, I can type in Lauren Gueits, and boom, there's everything you've ever posted. And so it's 50 forms, it's indexed, and there's 6 million posts. But anyway, the 50th one is TMD and occlusion, sleep apnea, snoring appliance therapy, and there's 81,000 posts in that section. It's appliance therapy, sleep apnea, TMD. So, Kevin, what I want to ask you is, number one, did I do that right? Should I have set that up? TMD, occlusion, sleep apnea, appliance therapy? Is there overlap? I mean, do you think it's wrong that I have appliance therapy and another section, sleep apnea, snoring, and another one, TMD, occlusion, all under number 50, TMD, because it starts with T, TMD and occlusion, sleep apnea, snoring, and appliance therapy? Are those all the same thing, or is it okay that they're separated?
They all overlap, but I think there'd be some great separation in there to move the appliance therapy part of that out, because it'll encompass all different types of things. And I think when you put it in with TMD or you put it in with sleep, that's all you think about is the appliances that are used for just those specific things, either orthotics or the multiple types of sleep appliances that are out there. You lose focus of all the arch development, even retainers and all the different areas of appliance therapy, space maintenance, all the things that encompasses by lumping it in with sleep and TMD. They're all intermingled, but appliance therapy would be, could be its own category without a doubt.
And I'm going to come back to the question again, because I know there's a big controversy in here somewhere. But when you talk about widening the arch, I mean, there's been orthodontists who have come on this show that don't believe that. I mean, you can't believe that 10,800 orthodontists agree on anything. So do you get much pushback from orthodontists saying no?
We don't. We've been making arch development appliances since day one. I'm at the lab right now, so I could walk over in the room right next to me where we store all the appliances that we've made over the last 85 years and, samples of them. And there's arch development appliances that go back that far. The RPE, the Hyrax was a Civil War appliance. The Jackson appliance, the same type of thing. They were all developed in way back before, 1900s, late 1800s. So they've been talking about it forever. If it didn't work, we wouldn't be making them. It's not a scam where we make them one time and that's all we want to do and that's it. We want to make them for everybody that needs them, and that can be for all ages. And we've been in business for over 85 years making those appliances.
And it's so fun podcasting, because the way you're sitting in front of that globe, Arizona is right on your head.
Right.
So I just look at your head, and it's like, oh my God, I'm right above his head right now.
So this was my grandpa's office, and he has the map of the whole world is the back behind my desk right here where I'm sitting, which is really a cool and honorable thing that I can sit here and do this way.
It is cool. I love maps. I just love it. And I do. In fact, what I always did is when I lectured in another country, I always went to Amazon and got the best book that was written by someone with credentials. They had to have a degree in something. It couldn't just be Karen's thoughts. And I always read the best reviewed history book on the flight over there while I'm looking at the maps, and it's so it makes the trip so much more rewarding. So again, to the kids, so I want to ask this slightly differently. So I'm going to ask it the inverse of that. Okay, I'm out of dental school. I got $400,000 of student loans. I hear there's a lot of money to be made in placing implants on old people. A lot of money to be made in clear aligners and Invisalign that you guys are all part of. There's sleep apnea, snoring. There's the American Academy of Cosmetic Dentistry putting on veneers. There's all these different things, and I can't learn them all at the same time. So I'm just going to ask you this. Why should I learn what you're talking about before implants or clear aligners for Invisalign?
Well, everything is based on the foundation. And so if you have any human being at any age, there's a really good chance they're underdeveloped. And prior to having any of the teeth worked on or fixed or added back in, you should really establish the foundation. You get one good opportunity to get the foundation right. So the earlier you see the patient, the better. But if you can grow that foundation appropriately, then you can address all of the other things you'd like to do after that, whether it's implants, veneers, crown and bridge, all the other stuff becomes secondary because it's based on the teeth. So it doesn't take any of that away. We certainly would like nice occlusion and a full complement of teeth and beautiful function with aesthetics that's stable and comfortable. The checklist still applies, but the idea is you do have a foundation and you do have teeth. And if you address the foundation, not only do you get an opportunity to take care of the list of things you mentioned, but you also develop the proper amount of space for the tongue and have a better breather. And if you have better breathing and proper tongue space, now you've got a healthier human being. So you start to tackle some of the symptoms that the medical community is treating in a chronic fashion by management versus you're going to be curing them by developing a better foundation for better breathing. So you have a different opportunity to treat a whole human being versus just fix their teeth. That's probably a nicer path for dentistry to be taking going forward versus just the focus on the teeth, which doesn't necessarily make it a bad thing, but you can have both.
And if I may add, the relationships you build while doing this, you get tons of referrals and the trust. They see you as a healthcare provider, not just a tooth doctor. So that really helps to build your business and establish yourself within the community.
Nice. One more thing to add to that. COVID is a respiratory illness, and we are all working very hard to be healthy and have stable immune systems, and the least amount of medications we're on and the healthier human beings that we are, the more we can stand up to our risks of contracting this virus. So that's a unique place that we're in that we've never been in before, but I don't think that it should be forgotten. So if these young people want to make a difference and also have a way to be different in their community, it wouldn't be wrong to include that.
Nice. And Lauren Gueits, you're the one who made all this possible. You're the one I reached out to first. Was there anything you were hoping that we would talk about today that I did not bring up?
I guess the only things would be to maybe discuss some of the myths in expansion. We get so many questions from doctors saying, well, I didn't think you can expand as you get older. I was told that I need jaw surgery. So I would love Dr. Miraglia to address some of those issues, or maybe you have some questions, Dr. Brand, about expansion.
Well, I got to tell you, you walked into that door when you said jaw surgery, because what I've always done is I've always said to the patient, if you had to do it all over again, would you do it? And when it comes to orthopedic surgery, I have had several long lectures about how that was a really bad idea. And I remember going back to my orthodontist, we're talking 30 years ago, and said, I don't know if I ever want to do this again. It was just a nightmare. Now, granted, orthopedic surgery's gotten a lot more conservative in 30 years. But then for the snoring and stuff, my ENTs got CO2 lasers and started roto-rooting the back of the throat. And I still have patients on 6-month recall that I referred to my ENT, and they always like to remind me, yeah, Howard, I still can't smell or taste any of my damn food ever since you sent me to Dr. Carbon Dioxide Roto-Rooter. And that is the one thing I want to give away to the kids for free, is that when you're young, you run out and try all these new things because you're a kid and you're excitable. And so I went to a course, and they said when someone really pretty comes in, you don't want to do a gold crown or a PFM. You do a Dicor crown, solid glass, and you cement it with Duralon, and they're beautiful. So that's what I did for like the first year or two out of school. Guess how many of them fractured, and when they came back and they broke, I had to redo the entire damn thing for free. Just guess how many, what % of them? All of them.
He threw
Every
us a
single
softball.
one of them had to be redone free. And so I remember when art glass came out. I don't know what art glass was, but the art didn't stuck for the glass. And Ivor Claire said, we got to get in on this. And they came out with Targus Vectrus. I don't know what Targus is and Vectrus is, but I know they had a divorce in every one I used in my patient's mouth as they delaminated from each other. And then when I saw Megagen come out with that bone thing where you need a bone graft. Well, you don't need a bone graft. You just pull the tooth, throw it in this damn garbage disposal, and it'll just pulpify the tooth, and there's your bone graft material. And I thought, yeah, knowing my luck, I don't know, maybe the body will have an allergic reaction to an enamel site or something, and the whole. So when you're a young kid, remember, there's a reason Grandpa's sitting there smiling at you on the porch saying, "Go give it a try and tell me how it works." Because we don't want to experiment on our own patients. So what I always tell the young kids is, just remember, you got to know yourself. Aristotle, know yourself. And you're young. You're excitable. You make really bad decisions. Warren Buffett, and they said, what is the hallmark feature of how to be an investment guru? And he said, well, all I know is all the billionaires, they almost only say no to everything. And they'll say like one yes a year, and they're right. And then you always know who the idiot is. They're yes to everything. They try everything. And so my deal is, this is worthy. Another litmus test is, does anybody do this full time? Like people come out and say, man, you should just be cosmetic dentist and only do veneers. Okay, well, I'm in Arizona. Show me where the veneerologist is. Is there a veneerologist that just does veneers? And so I know a lot of people have gotten into sleep and they no longer do root canals, fillings, and crowns. I mean, this is all they do anymore. So I think we're past the fad stage, even though I do think at least a quarter of my friends, and by the way, that probably seriously weights you to something is not right in your head or you don't have many options, but at least a quarter of the 60 and over crowd still think this is a fad, but I think it's past fad stage. I think this is medicine phase. I can't believe we went an hour, but Lauren, go through the myths. I want to hear the myths. Be the mythbusters.
Yeah, some of the myths would be that you can't expand past a certain age. Surgery is the only option for palatal expansion in adults. Extractions and IPR are needed for severely crowded cases. Aligners only tip the teeth. Posterior open bite is caused by aligners or intrusion. Children should wait until 8 for phase 1, and palatal expanders for the upper arch only. Those are probably the most common obstacles.
Okay, well, everything you just said is true, though. I mean, no, I'm serious. That's what we were taught. We were taught that the midline raphe, eventually it all calcifies and is dead. So that if you do anything, you can just tilt the teeth, but you can't actually expand the jaw. Is that no longer the case?
And it was never the case. And so the maxilla is nothing like the cranium. And so it's two different worlds, even though they're connected. So your cranial sutures do fuse. Your maxillary sutures never really fuse. You can use the word mature, but the maxillary sutures, and there are 7 of them that connect that maxilla to itself and to the rest of the skull, those sutures mature, but they take 7 decades to fully mature, which means you can use removable expansion devices to expand pretty much any adult you would meet up to the age of about 75 with significant success. So just because one, let's say, group or area believes that's not the case doesn't make it so, especially when you start to pull out orthopedic books to learn about the difference between the maxillary sutures and the cranial sutures, and they're two different worlds. So you have maxillary sutures that can be, let's say, induced to remodel at any age during the first 7 decades, whereas the cranial sutures cannot. And so total different world between cranial and maxillary sutures, and that's a lot of what we teach in the course. And then, of course, we show case study after case study after case study where removable expanders are the answer for adults, whereas fixed expanders can be a great answer for kids. So two different worlds. You're just dealing with the maturity level. In children, it's an immature suture. In adults, it's a mature suture, but it doesn't mean it can't be remodeled. The removable expansion appliances that Kevin was referring to, not only have they, been used for quite, a long history, but they're still, readily used in Europe a little bit more than in America. And just because America doesn't particularly use something in a majority doesn't necessarily mean it doesn't work. And so the idea is that we use our techniques across all ages for growth and development, and it becomes an additive technique. And so in using an additive technique, we end up giving you back more tongue space, more breathing room, better airflow, less resistance to airflow. You end up getting a better occlusion on top of that because you're moving the teeth out where they belong in the first place. Nobody's supposed to be so collapsed in anyway. So you could check box after box after box. And we basically spent 2 whole days going through all of those myths and what we might have been told in dental school. And it wouldn't be the first time either.
But where are those 2 days? When you talk about the 2, I'm on your website. Where is those 2 days on
Lauren's got that.
AirwayHealthSolutions.com.
Yeah, if you go airwayhealthsolutions.com, go to our events page, and then it'll take you to our mini-residency. We have it available online, and we also have a live course, if we're able to, with the circumstances with COVID, in October in Pennsylvania.
Okay, so now I'm seeing it. So online. Okay. So if you go to airwayhealthsolutions.com, and then you go to events, so the online courses 2027 live CE hours with Dr. Liao.
So that's one. That's our adjunct. But our 2-day mini residency is it's 1 day is pedo and the second day is adult dentition, which you can either take together or you can take separately.
Okay, I'm still not finding that.
So airwayhealthsolutions.com/events. It'll go right to the page.
Okay,
video.
Okay, there's events. Yeah. Okay, there it is. Okay, I am actually bona fide mentally handicapped officially in 18 different. So Airway Health Solutions 2-day mini seminar. There it is, and there's Lauren Gueits right on the cover. So it's a now online. Receive 18 live CE hours, and how much is that course?
Well, I would love your listeners to take advantage of our post-COVID Breathing is Essential Summer Special, which is July 10th and July 17th. And we actually are taking off $1,000 off of each course. So if you take both days, you're literally saving $2,000. And Howard, we do not discount our courses throughout the year. We just don't do it. So we figured this was a great time. We're trying to be helpful with the community. We know it's a tough time, but we also
send all of that to Kyle.
Will do.
And Kyle, when do you think it'll go? When it starts? July 10th.
10th is the pediatric course, and then July 17th is the adult dentition course. Okay. But we'll be having other courses, it's just not with the steep savings that we're offering for our summer savings.
And then the other thing you can do is if you got 20 hours, if you put 1 hour on Dental Town, what it does is it gets them to. I mean, I don't know.
You sold me already. You already sold me.
I'm trying to. How long have you been lecturing? Because I think I saw you at Greater New York meeting like a decade ago.
Absolutely.
Could that have been?
Yeah. I've been teaching for 13 or 14 years now.
Were you ever lecturing and saw some bald fat guy way out the corner who fell out of his chair?
I can't remember that incident.
You can't remember? Okay, then maybe it wasn't the
same I won't
same
confirm
course.
or deny that.
Okay.
But yeah, I've been teaching for a long time in a lot of cities, so they become a blur now. It's too many to recall them all.
I know, and it's so tough because whenever you call home, they're like, "Oh, that's so cool, you're in this city," and I'm like, "Dude, this is the 10th time I've been to this country, let alone the city. I mean, there's nothing. In fact, it's so funny because when you go to these places, they go, "We're gonna put you in the finest hotel in Warsaw." It's like, dude, I didn't come to Poland to stay at the Hyatt Regency. I want to stay in a dentist's house because the coolest part of it is like, I'll never forget, I think one of the coolest things ever is when you wake up in a different country and the dentist, if you're a dentist, you're family. And you wake up in another dentist's house, another family, and, and you go to the refrigerator, you open it up. And I can still remember opening up the first refrigerator in Cambodia versus Nam versus, Poland versus Russia. And you're just like, what are you eating here? It's just a bunch of weird stuff. But, oh, my gosh, that's so cool. But yeah, living in airplanes, that's a deal. So yeah, Ben, you should put an hour you can post that video. In fact, on an MP4, you can upload the whole video into it. I don't know if you want him to go to. Everybody has something different. So we went over an hour. I think we've covered this well. I just want one go away deal. My homies, they're scared. Some of them are depressed. I mean, really, some of them are they're scared. They're depressed. This COVID so if you're out of school, you can't find a job. If you're closed down for a couple months, I know dentists my age that were debt free and were figuring on selling their practice and retiring in 5 years, and now they've had to go out and get a massive mortgage on their house to keep their business alive. So we're 5 months into this shit show. July 1st is tomorrow. With that, we got a halftime for an hour. We got 5 more months to a presidential election, and the epidemiologists that I know at ASU say we're probably going to go into a fall. We're going to have another big outbreak, most likely in the fall, and probably the worst will be over at Christmas. So between the presidential election and the January 1st, you know, the worst should be behind us, and then next year will just slowly fade away. But give them a real world pep talk of what they should be thinking, how they can keep their shit together, and how do they, suck it up, Buttercup, and get ready for the second half of 2020. I can't believe 2020's only half over. It seems like it's already been 40 years long, and tomorrow it's just half over. So give them a pep talk. We'll go with Lauren, Ben, Rachel, Kevin. Give them a pep talk give them the halftime show.
Absolutely. Well, what I'm excited about with Airway Health Solutions is we can help the doctors. We can help you learn a new skill to become basically a whole health physician of the mouth. And that is empowering not only for you, but for your patients. You're going to help build their immune system. It's non-aerosol dentistry. You're going to learn a new skill by attending one day of our course. You can implement this the next day. Please listen to our testimonials of the doctors who've taken our course that share that with you. We also are like airway angels, if you would, that we recommend patients to come to you throughout the country who are trained by us. So sometimes I feel like an airway matchmaker between the dentists to help build their practices. And then if you need additional coaching and consulting, we're here for you, and we're affordable, and we can customize basically plans that are implementable for you, and you can use depending on what level you are at, so you can implement this right away. So sign up, take the course, and then you're going to begin going down that airway rabbit hole, and we're there to help you throughout the journey.
Nice.
Yeah, very good. And so, if we, think about why you got in dentistry in the first place and get back to the core of being a dentist is to help people. You have a wonderful opportunity to help people. And despite what the circumstances are outside of your practice, you still have to walk into that practice every day with a goal and a desire to give someone an opportunity for a healthy life and a healthy future and free of medical symptoms. And your best pathway to be free of medical symptoms going forward is to be a better breather, and a better breather having proper growth and development. And so if you're looking for a pathway to learn how do you give proper jaw growth and development across any age, we have that coursework and mentorship following. And next thing you know, it won't matter what outside looks like when you step into your practice. All you have to do is hear one patient tell you that they're breathing and sleeping better, and X, Y, or Z symptom has faded away, and you'll want to treat every single patient the same way for the rest of your career.
Nice.
I think all that was very well said. One thing, Lauren has been a mentor of mine for many years, and one thing she taught me was to stop looking at my life as being a tooth janitor, but really being a healthcare provider.
I've never heard tooth janitor. I've never heard that one. Very good.
So as a young dental professional, they've given you so much information so that you can make a difference and help somebody having a patient come back to you and say, wow, you changed my child's life, you changed my life, you solved this problem for me. These are ways that we can really make a difference in a different way. I mean, we've learned the nuts and bolts about how to be a really good dental or head care provider, but this course and the things that we do are simple and implementable. And we will give you all those tools afterwards. It's not just going to be getting a concept and coming back into your practice and not knowing how to implement it. And so I would encourage you to find a path that makes sense to you so that you can stay on that path and be the best provider you can for your patients.
All right, Kevin, the pressure's on, buddy.
Boy, I'll say that's a tough act to follow right there. What else I can add to that? Except that, I've been involved with a lot of different courses and CE groups over the years, and this is really one of the most exceptional ones out there because you get a full team approach with some really, really great people to work with that understand what you're going through and can really help you and walk you through this whole process. We see over and over doctors that take courses and then they kind of fade away and they get lost in the shuffle, but that won't be with this team. This team is here to really help you build your practice and implement what you're doing on day one after you've learned the knowledge. So I couldn't recommend it more highly.
Okay, I got a couple of follow-up questions, if you don't mind, with you. Back in '87, I'm trying to think of the man. I think it was a pediatric dentist where I would fly to St. Louis and learn intervention with pediatric removable. Do you remember that guy's name?
My dad would know him for sure.
Oh my gosh, it was a big lab. It was what?
Dr. Wolf?
It might have been Dr. Wolf.
What
was the name of that lab? The big lab that was it Dynaflex?
We don't say that word, but yeah, they're.
But anyway, the reason I was bringing it up is because back in '87, the pediatric dentist and the orthodontist, they didn't sit together at the study clubs because the orthodontist would say to you, well, what he did is he expanded the jaw, which ate the whole orthodontic benefit of 1,000. Then they show up with me and they have no orthodontic benefit. And I say, okay, so far we're only talking about money. Is there anything else to this story? But anyway, long story short, my pediatric dentist friends my age will tell you that they laugh when they listen to young pediatric dentists where they think the big controversy is silver diamine fluoride or not. They're like, shit, in our day, they wouldn't even talk to pediatric dentists if we did any interceptive appliance. And so my question to you is that still a thing? I mean, is pediatric dentists doing interception? Is that still a way to get taken off the free ham at Christmas from the orthodontist?
Not like it used to be. I know exactly what you're talking about, and it used to be a war. And it was
ugly. It was gross.
Yeah, the lines have definitely faded away from all that. We have lots of pediatric dentists that are doing some great ortho and consult with their orthodontist specialties when they have issues and things. So yeah, that definitely has eased quite a bit.
So here's my red flag to young kids. I mean, if you're a real doctor, you have one eye, and when I say doctor is a Latin word, docere, meaning to teach. So a doctor is any teacher, just like a Bible is Latin word for book. In fact, it comes from the Greek port of Phoenicia. I'm in Phoenix. So a Bible is a book, and a teacher is a doctor, a docere. But the first red flag that you're not talking to a doctor, a real doctor, a real teacher has one eye on their human and one eye on cost, and they're trying to drive down they're trying to use their brain to drive down the cost so the patient has the freedom to afford self-preservation, self-mastery. You can fix your tooth. You can do this. It's all about the patient. And whenever we're talking about a patient and your first question is the pediatric dentist use the Delta dental benefit, it's like insurance. If everybody works for an insurance company, then where are my 6 grandchildren going to go when they need a doctor? I mean, the saving grace of Texas was that my 4 grandchildren were all born there. I think that's the most important thing that ever happened. Have you ever even heard of Beeville, Texas?
I know exactly where it is.
Seriously?
Yeah.
People in Texas don't even know where.
Halfway between San Antonio and Corpus Christi.
Damn.
Yay, Rachel.
You won. There were 4 people contending on today's show, and you are the winner.
But I love my state.
When I look at dentistry, I mean, I'm 58. I'm only concerned about what happens to my 6 grandchildren when I'm dead, and I don't want them to go to a dental office and then call Delta Dental and say, "Hey, Delta." It's like, you're the insurance company. Who's the dentist? Who's the person treating the case? That's all I want to know. And my gosh. But anyway, last but not least, you two, you guys are, Lorna, you're both hygienists, right?
Yes.
You're both hygienists, and you both worked for Align a long time.
So I don't work with Align anymore.
Right. But you worked for him for like 6 years or so, or?
Yeah, I started out as a territory manager, which was wonderful because I got to go into the North Shore of Long Island, 200 dental offices, and see how everyone works, which was an education in itself, all the different offices. But really, to implement comprehensive care, Airway is definitely part of that.
And so where I was going with this is my most coveted wanted to, I've done the CEO of so many people, but I've never been able to track down Joe Hogan. Oh. So I bet you if a blonde and a brunette both asked him on the same day, he'd say, I'm going to have to do it. I'm going to have to do it. But yeah, if you ever get Joe Hogan, because I think they got a lot of people in Phoenix. They must have a headquarters or something. There's a lot of managers and other people in Invisalign.
I'm sure. Technology. I'm sure. They don't have a headquarters in Phoenix, but they have a lot of. I don't know their territories, but
they must have some regional.
We had a couple of sales meetings there.
Yeah, but I wanted to just show the kids how much something's changed, because some people. It takes them a long time to realize that you can't predict the future. So you took all these models, money's the answer, what's the question? The greatest programming first went into stocks and bonds, and they had all these assumptions about the future, which, remember Einstein, he told you 1,000 times, there is no such thing as the future or the past. You only have the present. You can't take your granddaughter out to the lake and say, see that area over there, honey? That's where the Big Bang was. No, the Big Bang doesn't exist anymore. It's gone. There's no sign of it. So the bottom line is on this look how fast everything changes. The orthodontists were trying to shut down all the competition from Align and Smiles Direct and the scanning and all that kind of stuff. So lots of states were in the process of shutting down teledentistry. And then the pandemic came out, and what did they do? Oh my God, we take that back. We actually need we actually need this. So life is a very fluent thing. If anybody's telling you where the stock market's going to be on Monday, they're out of their mind. So then after that, the 2008 collapse, where you had all these algorithms and all this computer technology, and it completely failed them, where do they use the technology next? Global warming, where they can set up assumptions. Well, if the Earth warms up 1 degree every year, they're all based on assumptions. They're not based on anything. The only thing you have is reality. And I think the one last thing you might want to think about as we leave is we are in a pandemic, and this kind of has a teledentistry play, doesn't it?
Absolutely. Rachel, why don't you touch upon that? Because you're the teledentistry queen.
Well, a lot of things, especially Texas, is very difficult as far as dealing with all that, and we're working that through our legislation right now, the Texas State Dental Board. But you can do a lot of these things. The doctor can have a consultation with the patient via Zoom. So that is really, I think, where a lot of this is going. And Dr. Miraglia, you can speak to this because you treat patients as well. I work with one of the doctors that has gone through a residency. I'm working with her. She's a pediatric dentist here in Dallas. And a lot of that for us to be kind to the parents and also their time and do a lot of that assessment. We can do that via technology. And I don't know if you even started to do any of that yourself, Dr. Miraglia, but I do believe that this really fits into that. How can we treat our patients without physically touching them, and so that we can keep that to a minimum?
Oh, yeah. Well, not only the consultation, but past that, when you're dealing with growth and development appliances, there's a fair number of visits can be done via teledentistry because they don't require adjustments. They just require monitoring and then questioning how that patient's doing at that point in time. And so I spent the last 3 months in New York being locked out of my practice, but any patient that had either a removable growth and development appliance or a clear aligner continued on the track and trajectory, and they haven't lost a day. And that could be done, virtually. And so what an opportunity to continue the treatment going. And by that means, then you keep your production going as well. And so those are the best patients. No one's doing a filling, an inlay, an onlay, perio treatment, occlusal adjustment through the computer. But growth and development, removable appliances, I can do that all week long. So can everybody else.
When you talked about, Rachel, your friend who's a pediatric dentist,
Yes.
I always had the hardest time deciding, should I become a pediatric dentist or be ran over by a cement truck? And I end up going with ran over by a steam engine. But God bless the pediatric dentist. I can't think of a worse idea on earth. What are you going to do for the rest of your life? I'm going to work on screaming, crying children. What I always say, what was the other opportunity? I mean, were you going to have to shovel shit in Louisiana at the dump? I mean, God, what was the other choice where pediatric dentist was the best idea? But that's what I love about people. The people that do pediatric dentists, they say they love it. I assume that means they're a Valium addict or benzodiazepines or probably just drinking Listerine. But thank you so much for coming on the show. Thank you so much for all that you've done. And thank you so much for getting Joe Hogan to come on the podcast next week, Tuesday at 8 o'clock. And peace out. Thank you so much for everybody for coming on the show.
Thank you.
Really appreciate it. Thank you.
Thank you very much.